Welcome, everybody, to Ask a CEO. I'm Greg Demetrio, the CEO of Lorraine Gregory Communications. And today we have a very special guest with us, Gunnar Lyslo, who is the CEO of a company called Surfacide. Now, before we get into the interview, I'd like to tell you a little bit about Gunnar. He's got 20 years experience in the infectious disease field. He was the director of infectious disease division of IMS. He was the president of Legionella, which focused on research and combating the Legionnaire's disease. And he's also the founder and CEO of Surfacide, that has developed a domestically and internationally patented ultraviolet disinfection system. The system's designed to eradicate the viruses such as SARS, MRSA, and now COVID-19. So it's a very timely interview. So Gunnar, welcome to the show. And I'm intrigued by the Surfacide system, for sure. I can't wait to find out more about it. But first, if you don't mind, I'd like you to tell the audience a little bit more about yourself and how you got to be where you are.
Well, hey, good morning, Greg. I really appreciate your interest in Surfacide and having the opportunity to talk with your audience. Yeah, so a little bit of my background, you had touched upon it. My background prior to Surfacide was in the waterborne pathogen space. And we had developed technology that was being used, to address the role of waterborne pathogens, primarily Legionella, which is the causative agent of Legionnaire's disease in these water systems. And it was a really interesting market. At the time that I was involved, it was a little sleepy, so we didn't see really accelerated growth. So I got out of that space, and then it developed or began a consulting practice that was made up of microbiologists and infectious disease experts. And kind of the same story, although our goal was to work with institutions to address, infection prevention or infectious disease related issues, still really pigeonholed into the waterborne space. But really where Surfacide then emerged was it was at a time where we were working with some of the academic institutions. And I still remember to this day where one of the ID docs put his arm around me and said, hey, we really appreciate what you did for us as far as related to all things Legionella. But we have the emergence of this organism that we don't really know what is going on, and it's making everybody very nervous. And that was MRSA, so methicillin-resistant staph. And, 10 years ago, staph was, to many infectious disease experts, kind of the world was coming to an end. Suddenly we had the emergence of a pathogen that was resistant to the vast majority of the antibiotics in the antibiotic pipeline. And so I kind of put my head, around this and thought, maybe there's a better way to break the overall initial transmission of this infection by addressing the role of the environment. And so I had experience with using UVC as a technology because we would occasionally use this in the water space. In fact, I know you're in New York City. In New York City, they use ultraviolet light to disinfect a lot of their water systems. And what we did is we just simply...
You changed your business model based upon what science was telling you was coming down the pike? Is that right?
Exactly. I just saw not only an opportunity, I saw an opportunity for a greater good, because as we saw the emergence of these pathogens, starting with MRSA, but now I'm not trying to scare people, but there are so many pathogens that are multi-drug resistant. Let's just take a look at kind of in your neighborhood, 6 months ago, we had the emergence of Candida auris, which is a highly resistant, fungi. So there's a lot of things going in the infection prevention or in the infectious disease world. And so I just thought by developing a technology that could, break the transmission kind of on those initial fomites, or where a lot of the healthcare workers' hands come in contact, or where patients' hands come in contact with these surfaces, I thought that there was a good chance that we could do some pretty good things. And it turns out that that is in fact the case.
Well, it's a very impressive background for sure. Not that I understand a whole lot about what you just told me, but yeah, it's very scientific based, and you're trying to make life better for people, and it's a wonderful endeavor. I was going to ask you why Surfacide, but I think you've already answered that. It's because what science is telling you is needed out there in the community, out in society. So maybe you could tell me
exactly.
Tell me how it works. Tell me how it works in layman's terms. Surfacide.
Yeah, so how the technology works is it's relatively easy or simple. Essentially, what we're doing is delivering a wavelength of energy that just happens to be in the invisible light spectrum, but it's this wavelength of energy that is germicidal. And so by delivering this wavelength of energy into whether it be a patient environment or a hotel room or a gym or a multitude of other applications, we are introducing energy into that environment that the bacteria, virus, and spore are susceptible to. And
Mhm.
so we're adjunctive to standard cleaning protocols. So I'd like to emphasize we are not eliminating the importance of just good old fashioned elbow grease and removing bioburden from these surfaces. But one of the biggest challenges that we find in healthcare is that the environmental services team, as hard as they're working, upwards of 50% of these surfaces remain colonized after a terminal discharge cleaning. So a terminal discharge cleaning, Greg, is defined when a patient is exiting the hospital and the new patient is entering the space.
Mhm.
So Gunnar is leaving the hospital after a positive outcome, and Greg comes into that room. 50% of those surfaces remain colonized with these bacteria, and
Mhm.
herein comes Surfacide. Surfacide is used, oftentimes in the healthcare space on a terminal discharge, and a terminal discharge is defined when a patient is leaving that space. So, for example, if I were in the hospital and I'm exiting, and then Greg, you need to seek care in a hospital in New York City, one of the greatest challenges that we have is that as hard as the environmental services team members are working on a daily basis, half of those surfaces remain colonized with bacteria. And so Surfacide is not eliminating, I want to emphasize, we are not eliminating good old fashioned elbow
Right,
grease and good old fashioned
right,
standard cleaning protocols next patient to enter that space.
right. So it's almost like the market came to you with this pandemic because of the need to sterilize or clean the rooms and so forth, where they were overrun with COVID patients. So what did that do to the inbound calls that you were getting? Did they go through the roof?
It went through the roof. And for those of us that are in the infection prevention space, this pandemic was something that we had been thinking about for a long time, perhaps not to this extreme, but we've seen the emergence of all of these multi-drug resistant pathogens. And so now here comes the pandemic. And given the data, and I'm an evidence-based medicine guy, Surfacide actually has data on the use of our technology out of the University of Iowa, specifically against coronavirus. So
Really?
SARS-CoV-2 is a coronavirus, and our technology was used specifically to address that virus.
So are you
Pardon
prepared
me?
for the uptick in business?
Well, I don't know that fully prepared. We were prepared from a research and a science perspective,
Mhm.
but when the phone started ringing, we had to ramp our production capabilities very, very quickly, and we are still ramping to this day.
So,
And so, since the initial outbreak in the United States, Surfacide is implemented within hundreds of hospitals.
so take me through the process from the idea to developing the beta to getting to production and to selling the mature device. That must have been quite a task to do. There must have been obstacles and challenges that you had to meet. Maybe you could tell us a little bit about that.
Well, yeah, it's a very good question. I think when I came up with the concept of using UVC as a modality, I had familiarity with the technology, given that I had used it to disinfect water systems. So I thought it was a relatively safe bet. Now, what I had no idea what I was really in for was just what is entailed in product development. So I was quite fortunate that I was able to surround myself with a team that did have experience in product development. But, Greg, per your question, it is no small task or certainly no small undertaking. And so this thing really took a life of its own. I've told many people, that I'm probably glad that I didn't know exactly what I was in for, because had I known what I was going to be in for, I'm not sure that I would have done it. But given that we're so far down the path, I'm not a guy that throws in the towel very easily. So I just continue to say, let's go for it. We encountered, multiple failures. So there were lots and lots of rough days. But when we finally, developed the technology and we finally had the data indicating that it would work, then it was really, what do we need to do to bring this to market, which was really kind of the next life cycle of Surfacide on what can we do. And again, I've been very, very fortunate in aligning myself with, great people on manufacturing, great people on our sales organization, great people on our back-end administration, to really, design and develop a technology that can be utilized not only by institutions here in the United States, we have a worldwide presence. So again, it's really no small undertaking.
It is. So all companies are interesting by themselves. Your company is based on science and data, right? And helping people. But if from the outside in, I'd envision your company as a bunch of guys running around in white coats, hunched over microscopes, and being very quiet. Is that the culture you guys have?
No, not really. Although we certainly value the guys in the white coats that are, conducting a lot of the research and the data that is paramount to the overall success of the technology. I think that our culture is that really of, of being, a group of very, very passionate people that know that we have a technology that can really make a difference. And I would argue that you probably talk with hundreds and hundreds of CEOs, and that's a common theme. Every CEO has started a company because whatever that particular widget is, they know that it can make a difference. And so again, with the team that we've developed here, and it certainly isn't only me, I'm but what's one very, very small piece in the cog here. We have developed a team and a culture that is incredibly passionate. And they wake up every morning knowing that we can do pretty great things.
That was my next question. What is it that gets you up and going in the morning?
Well, in the pandemic, it's clearly because we're making a huge difference. When we saw what was going on in China late in 2019 and early in January, I was talking with a lot of my infectious disease friends, and we knew it was going to be bad. We knew that we were going to face some very, very rough, turbulent waters. And unfortunately, we're likely going to face those turbulent waters here, for the foreseeable future. We're going to see some additional surge coming up here. And so given our technology and the fact that I just shared with you that we have data that is evidence-based demonstrating the efficacy of Surfacide specifically against coronavirus, we know that if we can get our technology in the hands of hospitals, long-term care centers, retirement communities, and even into the general community, whether that's gymnasiums or tourist attractions or hotels, we are reducing the presence of this pathogen and creating a safer environment. And I know that our team wakes up in the morning knowing that we've got a technology that is providing that level of safety and is trying to reduce the exposure of SARS-CoV-2 to the thousands and thousands and thousands of people that are encountering it on a daily basis.
I hadn't even thought about all the other applications that might be possible, and you just ticked off a few. More public places, hotels, gyms, things like that. Even I'm thinking salons and barbershops and things like that, which it might be cost prohibitive, but the point is that the application would work, which is really amazing. So let me ask you a question. I've seen pictures of the device. How big a room does that handle, and how long does it take to do its thing?
Yeah, so another really good question, Greg. So when you're using UVC as a modality, it's simple engineering principles, or more specifically, a simple law of physics. And so we know that UVC is a direct line of sight technology. And so there have been a multitude of entrants into the UV space since the pandemic. And where I encourage people to exercise caution is that there's no magic fairy or no magic fairy dust to get this done. And so with Surfacide using our multiple emitter approach, and let me explain that, the multiple emitter, that's the robotic form, although we don't happen to believe there's much robotic about our platform. That's what typically people refer to us as. We'll bring in multiple emitters or towers into a space, thereby bringing the vast majority of the surfaces within the direct line of sight. So we really checked that box. All of the surfaces are now within the direct line of sight. But more importantly, it's this simple law of physics of the inverse square law. And so, Greg, this is where you have to dust off your high school physics. You probably never thought that, that physics instructor in high school who was telling you about the inverse square law, you'd never think that you would need to know what that meant. But
Never
when it
hear it
comes to
again.
UVC, right? When it comes to UVC, that is perhaps the most critical element. And essentially what that law of physics tells us is that every time the distance is doubled, the energy is reduced to a quarter of the power, not 1/2. And so by bringing in multiple emitters, we are closer in proximity to all these surfaces.
Yeah.
But then the magic sauce is incorporated into each one of our devices as a mapping technology. And so it's a simple formula. Time plus distance equals total delivered energy. And so to specifically answer your question, in a typical ICU unit, we're in and out of that room in about 12 minutes.
That's
Now in an operating room, because that's a larger space, and so now this is where it ties right back to the inverse square law. In an operating room, it's typically 30 minutes because it's a larger space and it takes more time for the energy that's being emanated from our emitters to be delivered onto all of those surfaces.
Amazing. I mean, that's relatively quick. I mean, it's like you go in and you flood the environment with the UVC to make sure you're touching everything and get it as clean as possible. Very interesting. So
exactly.
I always ask my guests one question, and it's about what word of advice would you give your fellow CEOs and those aspiring to get to the CEO suite? Ask another way is, what's the best advice you've ever received, and what would you like to pass along?
Yeah, it's I think for me personally, if you're going to start a company, if you're going to, lead an organization, a lot of it is just about grit. It's about, setting that mission and then just never quitting.
Right.
And maybe I can speak more from my own perspective. We're still a relatively small organization. And we see failures on a daily basis. And while I'd like to say I wish we didn't see the failures, and perhaps it's overused, we learn from all those failures, but you just really have to be in a position of just never willing to quit. And so that's one of the characteristics or the attributes that I look for people that are joining the Surfacide team. It's kind of like, what is your makeup? What is your being? And if you're an individual that is just willing to grind it out and never say quit, man, you are on our team. I don't care if you're a PhD. I don't even care if you're not even a high school, educated. It's grit. Those are the people that we want on our team. And I think that's part of the reason that Surfacide has seen the success that it's seen.
When you get, I've always said that, if you bring your A game every day, I mean, obviously A games are tough to come by, but you fight for them every day. If you bring them to work every day, the effort is what's you're responsible for. The results will take care of itself. So if you got those people, if that's your mindset, I know it's mine. It's not about, what I'm not going to do today. It's what more can I do today?
Exactly. I could not agree more.
I really appreciate that you're taking time to sit down with us, and I don't want to eat up your whole day. But I'd just like to part with saying that this pandemic is something that we've never, ever seen. You may have seen it coming, but when it got here, it was pretty disastrous. And I just thank you for being the scientist that you are, to at least try and impact some part of this, because it's just a terrible scenario. We're just now starting to come out from our homes even. And with processes like yours, I know I spoke to many hospital CEOs as well, and that was one of the things that they all spoke about was cleanliness, cleaning, disinfecting. So you're right in there with them now, and I really appreciate it. So I wish you all the best. I thank you for coming on the show. And in terms of the pandemic, go get them.
All right. Well, thanks, Greg. I encourage everybody to continue to be safe. I know that given this pandemic, everybody is fatigued. Continue to follow some of the lead of Dr. Fauci and others, social distance and masks and all those things. And we will get through this. There is no doubt in my mind. I did say that we're still in some rough waters ahead. But there is no doubt in my mind that that as a country and as a world, we will get through this. So everybody should just hang in there.
Thank you. Thank you, Gunnar, very, very much. Wishing you all the best. Thank you.
All right. Hey, thanks, Greg.